Good evening, guys. Dr. Mukul here, your orthopedic instructor here at Unacademy. So, people who are watching me live, quickly give me a thumbs up to let me know that the audio visual is working well. Alright, perfect enough. So if everything is going well, I think I can just quickly get started. I wish to discuss, today the important instruments that we use in this branch orthopedics. You very well understand that orthopedics is a surgical branch, and just like a soldier is not effective without the artillery, a surgeon is very ineffective without good instruments. Not does he need to possess good instruments, he need to possess perfect knowledge to make the perfect use of those instruments. So that is the whole idea behind this session, that I give you that knowledge about the important instruments we use in orthopedics, and I give you this knowledge not just for the personal use, but to make sure that if questions also come from these areas, you get that straight edge, because this is an area that you won't find in the routine books. You need to see the picture of each instrument, you need to know how that instrument works, you need to know the indications, you need to know the problems. So question from this area would be straight edge, provided you have attended this lecture. So let me quickly start with introduction of some common instruments to you, starting right first up with the most basic of all instruments, the surgical retractors. Now these surgical retractors are basically meant to separate the edges of a surgical incision. They are basically used to separate the tissues that come in your dissection plane. Now when it comes to the surgical retractors, in orthopedics, you're dealing with bone. So first you have to dissect through the tissues that will be your dissection plane to reach the bone, because most of the places the bones are covered by soft tissues. Good evening, guys. Hello, Akhila. Okay. So the surgical retractors, they are basically categorized into two types. One are the simple retractors and one are the self-retaining retractors. Now a simple retractor would have these right angled blades. As a layman, you sometimes simply call them as right angled retractors, but a better way to denote them, you can use this word Langenbeck. So Langenbeck retractor is like that perfect word with which you can ask the sister who's assisting you to hand you over the surgical retractor. The problem with the Langenbeck retractor that you have to hold it manually. So sometimes you are short of assistant. So these self-retaining retractors are also available to you. These self-retaining retractors carry a ratchet. This is a self-locking mechanism. So once you open up the blades of these retractors, they stay in the opened up place with the help of this ratchet. So there's a retractor placed in front of you. You see the ratchets, you call it a self-retaining retractor. You see these right angle blades, you call it a Langenbeck retractor. And they will be meant to dissect through the surgical planes. Now in orthopedics, it's not just dissecting through the surgical planes. You have to lift the soft tissue of the bone so that you can see the bone also, because eventually you will be dealing with bone. So in order to lift this soft tissue off the bone, we use these special retractors that you can see over here. They are called the Hohmann retractors. A category of this that is highly curved is also called a cobra retractor, simulating the simile. It resembles a cobra, and as a layman sometimes we also call them as spikes. So you can call them as bone spikes. Okay. So sometimes as a layman we call them as bone spikes, but the perfect way to denote them would be the Hohmann retractors. So a Langenbeck will dissect through the tissues, a Hohmann will lift the soft tissue of the bone. Clear with this? Okay. So you've got your provisional certificates, Sumitra, after 30th June. Can you sit in the FMG? Well, it'll be difficult, this particular FMG. You might have to go in for the next one. Now this Chanley's retractor, just have a look at this picture. So here also you have this locking and holding mechanism. But see this area, it's being applied around the hip joint. Now Chanle is the person who's credited with performing the first total hip arthroplasty in orthopedics. So the retractor designed by him is again a self-retaining retractor, and this is specifically used in total hip replacement surgeries. So please have a good look at this Chanle's retractor, and this is specifically used in the total hip replacement surgeries, and this also comes under the category self-retaining retractors. Now from the retractors, let's move to the word forceps, because as you're going to go through your dissection planes, you're going to need forceps and scissors. So I'll take you through each of them. Now first of all, you're very much familiar with what a forceps is. This is a forceps, and I think you know that this is also a forceps. That's also sometimes denoted as an artery forceps, and this would rather be denoted as a thumb forceps, because you hold it with your thumb and the index finger, the thumb forceps. Now if you see the shapes, they're pretty different. There's no match between the two shapes, absolutely different, but they're still having a common word forceps in between. I'll tell you why. This word forceps is derived from a Latin word forceps, and this word basically means to hold. So basically both the instruments are helping you to hold tissue. The thumb forceps in a layman way is also called a pickup forceps, and the artery forceps tends to be a self-retaining type of a forceps. So rather than the word forceps, this is better called a clamp. So I hope you've got my message. Both of them are forceps. The self-retaining variety is that clamp artery forceps. Otherwise, if you just want to pick up a piece of a tissue, you take up this pickup forceps, that's also called a thumb forceps. Clear enough with this, guys? And then, you know, these are again some clamps, forceps. It's an interchangeable term. They may be used at different points of your surgeries to hold the tissues. The Ellis clamp, that's particularly picked up from the fact that the tip would have multiple serrated teeth. And please don't be frightened by the word teeth. Actually, Ellis tends to be the most non-traumatic of all these clamps. The Babcock, C for cups. So the Babcock forceps tips would be shaped like cups. So that's why we pick up this as Babcock forceps. And if you talk of a Cocker, this Cocker's forceps tends to be most traumatic. And if you see the teeth, they are very sharp and they are pointed. And since these teeth, they are pointed, that's why I'm calling it the most traumatic. Now, why would someone use a traumatic forceps? Hold. See, the hold that will be given by the Cocker forceps would be the best. But as you go down the ladder, the hold will be less. It will be weak. But as you go down the ladder, the hold might be weak. The trauma to tissue will be less. So while doing the surgeries, you know, we have to be careful and we have to be innovative. We have to see what we demand. You want to lift up some tissue, pick up some tissue, dissect through some tissue. You want to use these clamps or forceps. We see the damage that we can allow to happen to that tissue. And we need to see what kind of a hold we want. So that's how we ask our assisting staff to hand over these forceps. The sponge holding forceps. Classically, what you would find that the tips will be ice, and this is used in cleaning and draping. So before you start your surgery, you clean the part with antiseptic, you drape the part. So particularly for this cleaning part, we hold those sponges that are dipped in betadine or spirit using the sponge holding forceps, and this is picked up from the fact that what you would find at the tips would be these eyes. So I hope you are clear with the identification marks. Now in orthopedics, it's not just about holding the tissues. You have to hold the bone at times, and you have to hold your implants, plates, metal at times. So for this particular purpose, holding a plate, Verbugi has given the plate holding forceps. See the curved tips, the serrated edges. So you must be familiar with the tip of these plate holding forceps and the purpose to hold plates to bone during fracture fixation. So you're going ahead with the fracture fixation. You want to hold your plate to the bone before you put in the screws. You can apply these plate holding forceps. Now these plate holding forceps, they have to be little differentiated from these bone holding forceps. Now these bone holding forceps, they are used to hold bone fragments for manipulation to achieve fracture reduction. Now when you are operating upon a fracture, you first have to hold the bone. So with these pointed tips, you will be holding the bones. You will be moving the bones to align them. Now once the bones have been aligned, you will now move to these plate holding forceps, and in these grooves you can fit in the plates. So now even the plate can be held to the bone and the bone manipulated and aligned. So first bring in the reduction with the bone holding forceps with that very good grasp these pointed tips give you, and once that bone is almost aligned, now take up your plates, put them on the bone and apply the plate holding forceps to hold that plane to the reduced fracture. So clear enough, guys? How do we bring about fracture reductions with the help of bone holding and plate holding forceps? So are you clear with these special orthopedic equipments? Can I have that thumbs up? Yes, Shri, Tu, Sumitra, Akhila, clear enough with these instruments and implants? So just give me a thumbs up so that I know that the pictures are clear to you. They're zoomed enough to make you understand what's being taught of. Okay, perfect enough. Now as I told you that to dissect we also use scissors. Now there are two categories of scissors. We have medicine bomb and Meuse. Medicine bomb will be thin, long, slender in design. Meuse will be a stout but relatively a thick scissor. Now this Meuse scissor can be used for multiple purposes. It's a multi-purpose scissor. See the thick blades. But medicine bomb has very thin blades, so you can't use it for just everything. This is strictly used for dissecting through the tissue planes. So restrict your use of the medicine bomb scissors to dissecting through tissues. You want to cut some tissue, you want to cut sutures, you want to cut some fabric, your drapes, that with which you have draped the limb, you have covered the limb with sheets. So for all those multiple things, you can ask your sister to hand you over this thick Meuse scissor, but this thin scissor should only be used for dissecting through the tissue planes. Clear, guys? Now the biggest confusion that troubles me also at times. These pretty much similar looking equipments, and sometimes my sister would also struggle when I would ask her that hand me over a periosteum or an osteotome or a chisel or a goose, because they very much look the same. But I'll give you those tiny little points to let you know how to differentiate them all. Plus, I will let you know where should you be asking for which of the following similar looking equipments. So we go one by one. Let me first take up this instrument called a periosteum elevator. So first of all, from this whole list, this periosteum, see this tip. This periosteum would be very easily picked up by the fact that it carries a totally blunt tip. Other instruments would have very sharp tips, but you see that blunt tip, you know that this is a periosteum elevator. See here, a very blunt tip. Now when we are going with fracture fixation, we have to lift periosteum off the bone surface. See, let me be very clear. The ideal dictum is that if your periosteum is compressed under the bone surface, that will be damaged under the plate surface. So if you are putting a plate over the periosteum will be compressed and damaged. So ideally you should slice the periosteum and separate it. So to separate it, you push the periosteum to sides by using this periosteum elevator. You can also lift up tissue that is stuck to the bone using this periosteum elevator. So this will be used to lift up periosteum of the bone surface while applying plates. So now the periosteum can be closed over a plate later on, provided you have lifted it cleanly. So that's the use of a periosteum elevator. Now, not very different from periosteum elevator is this equipment called osteotome, or this equipment called bone chisel. But what you will find with both these things, there will be a pretty sharp tip. There will be a pretty sharp tip. So see the tip here, sharp. See the tip here, sharp. Now the difference between an osteotome and a chisel. In an osteotome, what you would find that both edges of the equipment will be beveled. Like. See, this is a tapering edge, and see, this is a tapering edge. But when I'll take you to a chisel, you will find that it is the single edge that is beveled. So this edge is a tapering edge, but this is a straight edge. So when you find single edge that is beveled, that is a chisel. When you find both edges are beveled, that is an osteotome. See, O, 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 O. So many O. So both edges, all edges beveled. So that's how I grossly remember when I get confused. Now an osteotome is basically going to be used for cutting through bone, or what you can say, doing osteotomies. Now you're very well familiar with these osteotomies. At times, we have to cut through the bone for some reason. For that purpose, we can use the osteotome. And chisel, same use as osteotome. Okay. But then it's by and large the surgeon preference, what he wants to go with. You can use a chisel and osteotome almost in the same manner. He has to choose as per what he thinks he would be more comfortable with. Now this bone gooch. Here you will have a cup shaped blade, and this is basically an equipment that is specifically used in bone grafting. And the purpose for which we use it is for harvesting the graft. So with this cup, you can scoop out pieces of bone from inside a bone. Like, suppose this is the pelvis, the iliac crest. ilium, and that's the iliac crest. Now I will remove this thin tip of the bone here, and eventually there will be a lot of bone lying inside here in the ilium. So with this cup I'll put my blade in and scoop out the bone to be used at the graft site. So that scooping out bone, for that harvesting of the graft, we use the bone goods. So clear, guys? So I'll just take you through them again. Find a blunt tip, that's a periosteum elevator. You find sharp tips, that could be an osteotome or a chisel. Single edge beveled, that will be a chisel. Both edges are beveled, that will be an osteotome. They will be used to cut through the bone during the osteotomies. But when you find there's a cup shaped blade, that means it's for scooping out that graft tissue from a bone. So that will be used for bone grafting. It will be a bone goods. So clear with these confusing things? And then may I just know from you, like this instrument that you see in front of you, I don't think you need me to tell you what is this. So this particular instrument that you see in front of you guys, so what is this? A mallet, a hammer, or both of them are same? Oh no, you have to just disassemble it and then decide what is it. So can I have some people helping me out with this one? Yes, A, B, C, D, 4 choices in front of you. So what should you ideally call it? A mallet or a hammer? Yes. Okay. It says hammer. Okay, so you can put in your doubt, Javed. Hammer. All right. So the house is favoring the word hammer. Yes. Meanwhile, Javed, you can just put in your doubt also. No problem. The chat box is right live in front of me, so I'll answer your doubt. Not a problem. Okay. So most of the people say hammer. I'll give it to you. It's actually a hammer. See, a hammer is something that's almost totally made of metal, and especially the handle is also metal. In a mallet, what you would find, the handle will be generally wooden. See the metal handle? So the metal handle makes the stuff go a little heavier, and this ensures that even with less of force, you get more of impact. Orthopedic surgeons, they are carpenters, but they are refined versions of the carpenters. So a little more sophisticated equipment. Clear? So what we use in orthopedics is basically hammer, and a hammer would be used to impact things. You may need to impact a screw at times. You may need to cut a bone. You have to hammer an osteotome to cut it through bone, a chisel to cut it through bone. So for all those purposes, we use the hammer. Sometimes we have to drive nails inside a medullary canal of a bone, so we use these hammers. Okay. So that's the purpose for which we will be using a hammer. Now this picture of the bone nibbler was there in the NEET PG exam little time back. Now a bone nibbler. Look at the edges, the tips. That's how you pick up a bone nibbler. This bone nibbler has to be differentiated from a bone cutter. And see the tips. Now what you would find with the tips of a cutter, that it will have sharp edges, perhaps to cut and shapen a bone piece. Sometimes we have to, like we are doing bone grafting, so we have to cut a bone piece and give it a particular shape to let it fit in to a particular gap. Like we have done an osteotomy and we've pressed some part of the bone and want to shapen the bone piece to a particular shape. That's where would come in the use of a bone cutter. Now this is pretty much different from a bone nibbler. It is used to crush bone into thin pieces or crush a protruding bone. Sometimes you have diseases where some osteophytes form, a part of the bone is protruding and impinging somewhere and damaging something. So for crushing that up is the purpose for which we use a bone nibbler. Now if you will look at the blades here, the blades would be such, they'll give you the idea that this is going to impact by crushing the bone. They won't be as sharp as the edges of a cutter. So cutter will help you to shapen a bone, and nibbler would help you to crush a bone. Clear with that? Okay. Alright, Javed. So you cleared the NEET UG 2022. When you should be joining Unacademy for PG? Well, dear, I think you should start your preparation at the earliest, Javed. The earliest you join the platform, the better it is. There's a lot to begin from the platform, so many lectures to be watched, so much of material to be read. So the earlier you join, somewhere in the middle of the first year, I would say, is the appropriate most time. But at least by the second prof, you must be onto this platform to take the maximum advantage. Okay. So done with these instruments. The instrument part can never be over until unless I've spoken of this CURET also. So here also you find cup shaped edges. Okay. And a CURET is used for a special surgery that's called curettage. This curettage is done in bone infections and bone tumors. And this curettage basically means scraping infected or dead or tumorous bone off. So when you scrap off the bone, abrade it to remove that infected material, that tumorous material, that is the purpose for which you use this bone CURET. Clear with that? And then a word about the casts we use in orthopedics. Plaster of Paris is what we use for these casting materials. Plaster of Paris is nothing else. It is basically calcium sulfate hemihydrate. So that is the chemical formula of plaster of Paris. And any idea? Plaster of Paris, who discovered it? Who's credited with this discovery of plaster of Paris? Anyone who can help me? Okay. So Sumer says, I'm in class 10 and preparing for NEET PG. Well, Sumer, class 10 is too less. Things might change when your time comes. You never know what even the world remains or not. So focus on your 10th, 11th and 12th for the time being. But yes, you have a dream to be a doctor. Keep it therein. You're going to require good effort. So try becoming disciplined in your life. And try becoming hardworking in your life. That's what my message to you would be. Okay? Alright. So anyone who can help me out who discovered plaster of Paris? An old NEET PG question. Alright, no problem, I'll help you guys. It was discovered by this gentleman, Antonius Matheson. So he was an army general. He is the one who discovered this plaster of Paris, and all these things started casting, applying plasters, and we made multiple uses of plaster of Paris. And perhaps from plaster of Paris now we have shifted to fixing the bones with metals. So next lecture I'll be talking of the implants we use in orthopedics, the plates, the nails, the screws and everything. But today it was all about the instruments. Okay. So not Pirogov, it was Antonius Matheson there. So please just note it down. So that's all from my side. I'm done with it. So if you like the lecture, you can use this code to subscribe to Unacademy. Okay, just taking you through some good offers. We have 20% off. Okay, this unlock 20, this is the code you can use. Okay, and just some batches coming up. An extra edge batch by Dr. Nikita. She'll be taking up all subjects, giving the high yield mnemonics, so people who have their exams coming up the perfect way. Make sure to assess all the MCQs in this Unacademy light version question bank series. Very good material and very high yield material. You have a number of questions there to make sure that you miss no question in your exam. This integrated system batch wise is also going on. Mine is on 16th of August, collaborating with the anatomy faculty, Dr. Ankit, to give you the best of orthopedics. Okay, the clinical aspects. So we'll be looking forward to having some of you as subscribers on Unacademy to attain the maximum benefit. So that's all from my side, guys. Okay, you want me to let you know the Telegram channel. So this is a small Telegram channel I run, t.me Dr. Mukul Ortho. So you can connect to me on this Telegram channel in case there's any doubt after the class. Otherwise, the best way to be in touch with me to be a subscriber at Unacademy, and make sure to use this code OrthoLive when you're subscribing. So all done from my side, guys. I hope you enjoyed the session, you benefited from it. I could give you some extra edge. Any doubts before I finally close down? Well, I'm really sorry to say the PDF of the YouTube lectures is not available to you. But sometimes these lectures would be taken up on Unacademy platform. I'll be definitely taking them up. I generally take them up in a course called Extra Edge Ortho. So if you're a subscriber, they're already available. So you'll be able to download the PDFs from that part. So these are just free sessions. Unable to provide you PDF, the software does not allow. Fine. Any other query, guys, before I close down? Okay. So hope you enjoyed. Good night for now. See you again for another session. The next session I'll be taking up all the important useful implants in orthopedics, the nails, the plates, the screws, and some other related material. So good night for now. Bye bye.